lethal. That's the word doctors now use for loneliness, more dangerous than smoking 15 cigarettes a day. And almost nobody talks about what it's actually doing inside the human body, because the science is more terrifying than the headline. In 2023, the US Surgeon General did something rare, issuing a formal public health advisory for an emotion. He called loneliness a national epidemic. The data behind it was staggering. Social isolation raises the risk of premature death by 29%, comparable to the impact of smoking. Stroke, heart disease, dementia all climb. The mortality cost matches smoking nearly half a pack a day, every day, year after year, for life itself. But this cigarette is invisible. There is no warning label, no ban, no tax, no marker on a death certificate. Just a slow, quiet exit attributed to other things. Here is the part most people never hear. Geneticists call it CTRA. The Conserved Transcriptional Response to Adversity. Pro-inflammatory genes turn on. Antiviral genes turn off. The immune system behaves as if it is fighting an infection that doesn't exist. Cortisol rises. Sleep fragments. Wounds heal slower, measurably slower, in lab after lab. The body is paying interest on a debt nobody named. Brain scans show something stranger still. The anterior cingulate cortex, the region that fires when we feel physical pain, also fires when we feel socially excluded. Loneliness, neurologically, is a kind of injury. Over years, gray matter shrinks in the regions that build empathy. Loneliness is not a feeling sitting on top of a body. It is rewriting the body. To understand why, we have to look backward. For nearly all of human history, we lived in groups of around 150 people. Inside that group, an inner circle of roughly 5 close bonds did the real work. The people we ate with, slept near, mourned with. We did not evolve to scroll past 2,000 acquaintances. We evolved to share a fire with 5. Anthropologist Robin Dunbar's research suggests this number isn't cultural. It is cognitive. It is the architecture of the human brain itself, shaped over millions of years. And then something strange happened. In the most connected era in human history, the youngest generation became the loneliest one alive. The numbers are unsettling. Recent surveys found nearly 4 in 5 Gen Z adults report feelings of loneliness. More followers, more group chats, more notifications than any generation before, and less of what actually counts. Less of the one thing that actually regulates the human nervous system. Unhurried, in-person presence. Time spent with friends, in person, has fallen by roughly 70% for Americans aged 15 to 24. We replaced the fire with a feed, and the body never quite believed it. What's striking is how small the antidote actually is. Researchers don't recommend 100 friends. They recommend 1 meaningful conversation a day. 5 close bonds. Pair-housed animals heal faster than isolated ones, even under identical stress. Connection isn't a soft skill. It is a measurable biological signal that we are safe. So maybe the question worth sitting with is, when did any of us last feel truly heard?